guys have turned the medical series and you guys have turned the medical reaction series into a total hit, but I wanted to take things to the next level. So I partnered with the folks from the TV show The Resident to give you a behind the scenes look of the set, interview one of the main actors from the show, Manish Dayal, and even tried my hand at acting. They offered me an Emmy. I was like, chill for a second. I'm here with Manish Dayal, who plays Dr. Devin Pravesh.
Amazing doctor, gifted doctor, 5 stars.
Do you ever have difficulty on set? There's a word you don't know. How do you prepare for that?
All the time. I mean, every script, there are these words. I often will look at the procedure or what the word means on YouTube first, and then I have sort of a visual. There's one in particular that really threw us last year. It was Negliria fowleri.
Negliria fowleri.
That's right.
What's your view, or how has your view changed of doctors now playing a doctor?
Oh, I mean, I've always had great respect for doctors. The dedication, the commitment. I have an even greater respect for just the amount of knowledge that doctors have to retain and exercise every day. It's immense.
It's crazy because on top of having to know, even your character, right? Well-researched, well-studied, Harvard, knows a lot of textbook information.
Sure.
But then applying it in a practical sense to another human being who's so complex.
Right.
That's such a challenge that people normally don't highlight.
There's a stage of being a doctor in school and outside of the hospital, and then you see doctors inside the hospital and what changes and how they're applying textbook information, academics to practice, and it can be discombobulating, especially for Devin in the first season.
Yeah, big time.
What is the first question you ask in code?
Rhythm.
We're on set right now. You have multiple sets here. You have the ER, OR. Do you mind giving us a little tour so we can sort of break down how realistic this is from a medical standpoint?
Absolutely, no problem at all. This right here is the ER.
Okay.
We have 10 trauma bays here. This is the nurse's station.
Yep. Very accurate, might I add. Yeah.
Tell me about what this is.
Well, so initially when I walked in here, I was really impressed with the attention to detail. Like, this is really cool to show people at home. The Post-its are legit.
Legit Post-its.
Legit Post-its.
Legit
Our computers
Post-its.
are covered in Post-its.
These
Did the
are-
phones work? Like, what? How accurate?
Oh, no.
Don't look at these.
Yeah.
Patient privacy, Dan.
Yeah.
What are you doing?
Don't violate HIPAA, right?
Yeah, HIPAA. See, he knows about HIPAA.
Yeah.
This is very accurate. The beds look like they're functional. The rails go up. So this is
Yes, so
this is very
so
realistic.
during a scene though, dude, so basically we'll be doing
To
a scene.
figuring out
and
how
you're
to lower it.
And then it doesn't work.
Yeah. This blood pressure reading is a little crazy, 91/132. So this patient.
What's wrong with that patient?
This is just not. This is not a live person's blood pressure. The lower
person's
number.
dead.
Yeah, this
so this
person's
person
dead.
is absolutely dead. So this is the ICU.
Okay.
She was
This is
having-
very accurate as well.
Is it?
Yeah, the rooms need to be able to be isolation rooms. The way that they're spread apart is very accurate. The nursing station being in the middle to have a view of all the rooms is very important. This chart is actually really realistic also, because when the patient is in the ICU, they can develop something known as delirium, where they don't know where they are, and looking at this can help them a lot. They'll know who their nurse is, who their doctor is. It also is helpful to some of the nurses taking care of the patients to know what they're supposed to be eating. Honestly, if I walked in here and I had no idea where I was prior, I would say I'm definitely in a hospital. Like, there's no way I would say that this is a set.
Now we're gonna move to the OR.
Let's move to the OR.
Which is where all the blood and the guts and the gore and the,
Which was the first scene of the entire show.
Oh, yeah.
Right? That's when
That's where
the
we're
mistake
going right now.
happened. Yeah. I got chills during that part.
Really?
Because I've seen medical errors happen in front of me, maybe not to that extent, but I remember it brought up all these feelings of what I felt during those moments.
Right.
And it made you feel as if you were there. So it
and
was,
especially as a young doctor, when you have, when the responsibility to your job, but also your bosses and the people
a lot
who
of
employ
conflicting
you.
interests.
Wow. This is the ICU room. I mean, there's so much blood on this floor usually, you wouldn't even be able to walk. We have this machine, the blood splatter machine.
Okay.
There's a pump that looks like a helium pump.
Okay.
And attached to it is a clear tube that gets hidden under the clothing or taped behind the arm of the patient. And so when it's time for the blood to squirt, they pump it and the blood just squirts up.
out.
And usually my character is behind that glass just watching.
Yeah, because you're not a surgical
I'm not a
resident.
surgeon. I
But
wish.
You do rotate, right?
We
throughout
do
your
rotate. I think
experience.
right now I'm in the ER, and if I'm lucky, I'll get to move to surgery. But
Okay.
This is another, here, we'll go in here.
Wow.
So in the next episode, which we start shooting on Monday, it's the Halloween episode.
Okay.
And everyone is tasked with a different job. But there's this big Halloween party, so the doctors all go to the Halloween party, and my character is left in the ER to treat this arm that comes in. What up? What up?
These lights are legitimate. You see like this little covering on the light is to make sure that even when you touch it, you still maintain your sterility. So Sunshine is the one that generally gives you the guidance on mistakes that you're making.
She's our medical wizard. Yeah.
How often is she saying, guys, you have to stop the scene because the technique is wrong here? Does that happen often?
Well, she won't stop it while we're taking. She'll wait until we call cut.
Got it.
She'll come in with a note and we'll implement it and shoot it again.
Awesome, yeah.
Because there's always pieces they can take.
How many cameras are going at
3, and sometimes
3
4.
cameras. Wow.
We watched them film a scene for season 2. I'm not gonna spill any secrets, but it's incredible how many things are happening simultaneously. There's multiple cameras moving around, actors, actresses, extras. It blew my mind how much needs to happen in order for one scene to get taken in the perfect way.
Who is this gentleman?
This is, let's see here. I have no clue who this is.
And then this is sort of the viewing
This is,
room?
yeah, we're there's a scene in the first episode where we're all viewing a very complicated surgery, you know? If you're an internist or someone not allowed in there, you'll see.
Medical students can hang out in
students.
here. So medical students at home, this is where you would be hanging out, watching the operation go live.
Yep.
The signs are accurate in terms of which way to go. They're complicated just like there are in real life.
After getting the tour of the entire set, I really wanted to know firsthand what it would be like to be an actor on a medical drama. Manish was kind enough to do a little improv session with me.
I am Dr. Pravesh. What's your name?
Hi, doctor. What took so long? I don't understand. I've been here for an hour.
I'm sorry, you see all these patients we have here now. So what brings you into the ER today?
My stomach's been killing me, doc.
Okay.
I don't want to be frank here, but my stool, it's disgusting.
Wow. How long have you had these symptoms?
Like 24 hours. I came back from Mexico. I don't know if it's Zika. What am I doing here, doc? Is this it's tumor?
No, it's not. We'll get to the bottom of that.
Oh, my stomach. I like your stethoscope, by the way.
Oh, thank you. Thank
Matte
you.
Black, it's a great choice.
It is, yeah. They sponsor my practice.
Doctor, why are you listening to my lungs when I told you my stomach hurts? I don't understand. You see, I can't act. I'm sorry. I'm going to stick to being a doctor. All right, Manish, we appreciate you taking out the time, showing us behind the scenes, allowing me to show off my horrible acting chops. What grade do you give me?
I give you a solid A.
Wow.
Yes.
That's too kind. He's obviously lying. But again, thank you for taking out the time. Everyone, check out the season premiere of season 2 of The Resident. Stay happy and healthy.